Hi, I'm Ryan Sunderman, UnityPoint St. Luke's Emergency Department Medical Director. We've taken great steps during the COVID pandemic to make sure that we keep our patients and our staff safe. This includes postponing elective surgeries and limiting visitors within the hospital. As we move to the next phase of the pandemic, we are beginning to do more elective surgeries because they just can't wait any longer. We'd like to take this as an opportunity to tell you a little bit about what we're doing to make sure we keep you and our staff safe. Once you arrive at the emergency department, you'll be screened at the front door for COVID-like symptoms. Based on your complaint, you'll either go directly back to a room or you may be asked to go to one of our waiting rooms. We have two waiting rooms, one for respiratory symptoms and one for non-respiratory symptoms. Everyone will be provided a mask upon entry to the hospital, and all direct patient care staff will be appropriately protected. In order to limit the number of patients that actually have to enter the hospital, we brought in this building to do additional screening outside in the parking lot to limit the number of patients that actually have to enter the hospital. Patients that come into the emergency department with symptoms unrelated to COVID, things like chest pain, symptoms of stroke, or injury, are brought to a completely different area of the emergency department. This is true for the hospital as well. Those suspected of having COVID are brought to completely different floors from those that are suspected of having heart attack, stroke, or needing surgery. Our preoperative testing and screening is more robust, which improves safety for patients and staff and helps us to conserve personal protective equipment. We change our PPE basically for every patient. We have more than enough PPE now. Initially during the pandemic, there were some shortages across the country. Our N95 masks we'll wear typically throughout a whole shift, but we change those out. Our face shields we change between encounters, and we have plenty of gowns and gloves if we do go into any of the respiratory rooms. Our staff are required to wear appropriate PPE at all times when caring for patients. They also are required to monitor themselves for temperature and symptoms twice daily. We know our PPE is working because none of our providers have tested positive for COVID-19. We intend to continue restricting visitors to our hospital and clinics to ensure that there is limited exposure to others. The way we are triaging patients in the ER allows us to keep patients and our healthcare providers safe while still providing exceptional care. Your well-being is our #1 priority here at St. Luke's Hospital. We would not resume these services unless we were 100% confident that we could keep you safe. Thank you for choosing UnityPoint Health, St. Luke's Hospital.